Now you need to apply to individual states or territories to work, but that possibility exists because you passed a national board. So a little bit more on that a little later. Let's talk a little bit about what we saw in the vignettes and what a physical therapist assistant does. Really, we manage all sorts of conditions, primarily musculoskeletal conditions. And as you can see on the slide, the APTA in 2017 said that PTAs managed conditions such as back and neck injuries, sprains, strains, fractures, arthritis, burns, amputations, strokes, diseases like multiple sclerosis, Parkinson's, congestive heart failure, COPD, birth defects, injuries related to work and sports, blah, 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 blah. I could go on, but primarily it's taking people from one functional level to another. Where do we work? I think we covered that in the vignettes as well. Hospitals, outpatient clinics, rehab facilities, skilled nursing facilities, home care, education, schools, hospices, industry, fitness. I have been a therapist for 34 years. Yes, this is gray hair that you see in this video. I have served in a variety of capacities, from training rooms to football locker rooms to professional artist pavilions to I teach in schools. I work in the outpatient clinic, and I also do a bit of home health. And I've worked in acute care hospitals. So in 34 years, I haven't just sat somewhere and stayed in that little cubby or at that little desk. I have worked for a variety of employers in a variety of settings, all focused on doing the best intervention for my patient at that time. And while I've been doing it, I've been pretty well paid. So I am sure that most of you know the market for healthcare is usually stable. Are we going to cash in and be the millionaire? Maybe not. That usually doesn't occur. But our salaries based on BLS data and One Stop Salary Finder in 2017 said that physical therapists in Houston at the low end typically made about $42,200, and at the high end, $87,700. And so that's kind of your range that you see on here. You can also see that the red in Texas is a little bit better than the rest of the United States. So if you get your education here and decide to work in Texas, you're probably going to be pretty well paid as compared to other physical therapist assistants around the country. How you go about getting one of those jobs is that you apply for an associate's degree of applied science. We are a program accredited by CAPD, and I want to talk just a minute about accreditation. Accreditation is very important. The Commission for Accreditation on Physical Therapy Education is responsible for accrediting all the national physical therapy and physical therapist assistant schools. It is one of the accreditation agencies that is accredited by the Department of Education. So it carries a lot of weight. In fact, you cannot get your degree or sit for your boards if you do not graduate from one of these programs. So I encourage you to look at a lot of programs to apply to because the application is very competitive. But when you do, make sure they grant the AAS degree and that they are accredited by CAPD. Our program is approximately 5 semesters in technical education. We have 1 semester that's a prerequisite semester. So if you want to rephrase it, we have 6 semesters, 1 being a prerequisite and 5 being the technical component. You will finish within 104 consecutive weeks. You will need 40 hours of observation, observing a PT or PTA in doing something that they do, that they're licensed for. And more on that in just a minute. You will also need to take the ATITs test, which is an academic application test that is typically given between March through May. We are going to go to the website at the end of this program and look at those deadlines for this year. And our application is typically due in May, unless there are unusual circumstances, hurricanes, COVID-19, something that befalls us. So check the deadline on the website to make sure what the current deadline is. Now back to that observation hour. The observation hours are 40 hours of observation, watching a PT or PTA doing what they do. How you would go about that is you would call one of the local clinics or local hospitals, ask for the rehabilitation department, and then ask to be able to observe in that setting. A word to the wise, not all of our settings are going to want to have observation students observing their patient due to confidentiality and privacy reasons. So be mindful and professional when you call these clinics and ask for observation hours, that you understand they are giving you insight into the professional that you want to be. Once we finish this, I will be going through the observation form. You will need to have the clinic fill out the observation form, seal it in an envelope, and then you put a stamp on it and send it to our office. The ATI-TEAS test is also something that you'll refer back to our website for. The ATI-TEAS test is done by scheduled exam only. You may only take it once in a year, and you must take it once in a year. We cannot take old scores. Those scores are then put into your application for you, and I can explain what that looks like. All right, so some application requirements. As soon as I get done with this page, we're going to pull up the application score grid so you can look at it more closely. In order to apply to the program, you must have earned a cumulative GPA of 2.0 or higher. You must have earned a passing grade in English 1301, Psych 2301, a C or better in 1201, and a C or better in Biology 2401. Those are the 4 prerequisites for our program. PTHA 1201, English 1301, Psych 2301, and Biology 2401. All of them must have earned C's or higher in order to be eligible to apply. And when I say eligible to apply, I mean the application will open. Only 2401 of those 4 courses has to be taken within the last 7 years. We don't want physical therapist assistant students who are not current in anatomy and physiology, because that is our practice. Also, all transcripts from other universities. About 60% of our students have prior bachelor's degrees and want to use some of those credits in the application process. In addition, we have some international students who have earned degrees. Both those students must send in their transcript to be evaluated by Lone Star College. So you apply to the college, send your transcripts in, and then get a Lone Star College ID that allows you into our portal, that then shows you what grades have transferred. A couple points on this. Lone Star College students, you do not need to do this step. We already have your transcripts. International students, you must go through an approved international transcript evaluator, and those names are located on our website in our course catalog. And once the international transcript evaluator has evaluated your transcript, you send that packet into our office. All right, let me pause a little bit here, and I am going to pull up our score sheet for you. If I can do it this way. I can, here we go. So you should all be able to see this. This is our, obviously, our score sheet. And I want to talk you through each of these little points. So the first point that I want to talk you through is that first box that says ATI-TEAS testing. You'll notice that we give points based on your percentage on the ATI-TEAS. And the ATI-TEAS academically measures reading, English and language usage, science, and mathematics for a total of 24 points. So if you were to get between 75 and 100% in reading and English and science and math, you would get the total of 24. There is no minimum score. So whatever you score goes on your application. You can get a study guide through Google, through Amazon. And that study guide is for the ATIT's Health Occupations Aptitude Test. We don't recommend a particular study guide, so any will help. The next box is degree plan prerequisite courses. These are things that are found in the degree plan. And notice that the prerequisites 1301, 2301, 1201, and in the next box 2401 are all listed as prerequisites. You will earn 4 points for an A, 3 points for a B, 2 points for a C. And then in 2401, you will earn 4 points for an A, but we're going to double it. So 2401, we take your grade and double the point. What that should tell you is that the admissions committee feels very strongly that a good foundational background in anatomy and physiology is absolutely essential for this program. So we recommend you take this, you study hard for it, and get as high of a grade as you can. The next box is degree plan, additional courses within the degree plan which may be taken but are not required to open the application. There are two, biology 2402, which that point will be doubled, and 2306, which falls along the normal grade criteria, 4 points for an A, 3 points for a B, and 2 points for a C. It's important on this philosophy 2306 that all my students out there that have attended other college and have taken some kind of philosophy course, it needs to transfer in as this course. We do not accept very many appeals. I will tell you now, the appeals that tend to be more acceptable are those that include bioethics or ethical decision-making for the healthcare professional. A general philosophy course will typically not meet this requirement unless it comes over as philosophy 2306. When I say comes over, all of these grades are taken from your grade transcript that we have in your portal. That's why it's so important if you've attended another college that you send in your transcripts early and keep checking your portal to see what credits are going to transfer. Now that you've had this information session, you have the rubric that we score. There are no other hidden points for grades. Now let's talk about some bonus points because I am a huge fan of bonus points. The admissions committee feels that the stronger the student is in science, the better they are prepared to progress through our program. Therefore, they award bonus points for Psych 2314, which is a lifespan that deals with lifespan issues. I think we all can agree that our patients are across the lifespan. This is an excellent course. Biology 1406, or any college level chemistry or physics that are for science majors. You'll see in here the biology 1408 in the Texas Common Curriculum is not allowed because it is for non-science majors. Also, we give a point for completion of a bachelor's degree or higher. You only get a total of 4 bonus points